Hi everyone, welcome to Center of Balance Live. I'm Phua from Center of Balance, the acupuncturist. This is number 59 live. Now today's topic we're going to talk about annoying pain of knee pain. I'm going to give you some tips if you suffer from knee pain. Well, first I want to tell you that you have to read the disclaimer on if you're on Facebook, it's on the top. If you're on YouTube, it's in the bottom. Okay. Recently I have a case come with knee pain. Well, when we go for knee pain, in our clinic we go to the long intake form. In a long intake form, I discovered that this patient has actually had according to Chinese medicine, okay, the diagnosis related to the spleen and stomach. So she had suffered from a lot of tummy pain and bloating, So that is, well, in the Western side, it may not be a cause of, it may not be linked to the knee pain, right? And in this patient as well, she never thought it will link to food, and she was exercising a lot, so it's an injury. Then, well, most of us, when it comes to pain, we would think of whether it's a posture problem or it's a stress or it's because you're working too hard, been using it or overuse it, all this thing, right? If you go to chiropractor, osteopath, and a physiotherapy, we all focus on, how do you normally use it, and what exercise do you do? Do you feel pain when you do things? It's all about movement, range of movement. When you work, are you working too much or things like that, or your sitting position, standing position, look at the structure change, I mean, all this is right thing to do, it's right to check all this, but most people will miss out this is your diet. Why am I talking about diet a lot? Because I do find it doesn't matter where you go, most practitioners miss out about diet. So in this patient, and according to Chinese medicine, diagnosed as the spleen and stomach out of balance. So spleen and stomach control muscle strength. That is why that this patient should get relief from a lot of practitioner, a lot of therapies, but it never get to the end. You see what I mean? So it always come back. This pain always come back. So I told her about the diet. I say, well, first get your stomach and spleen function restoring your stomach and spleen function first, so you feel much better with bloating, pain, heartburn, and diarrhea. So she changed the diet. So I give her herbs, acupuncture. Now, I'm not so focused on the knee pain yet. Why is that? Because I know there's underlying issues causing the knee pain. So she won't get good results or see a big difference. I mean, a long-last result before we boost up her stomach and spleen functions. And guess what? While I was treating her and she got better, then she figured out one thing. If she told me that she figured out one thing. She went to a party and then had some different things that she wouldn't normally do and eat, and then the next day she got quite a lot of swelling underneath. You see, and then she was bloating again and pain again and diarrhea again. And then she just realized, she told me, I didn't realize that the food was actually causing my knee problem. I said, that's it. Because it's, if you exercise a lot, you go to gym and everyone talk to you about is, how you train yourself, you see. And when you train and you get pain, you more focus on the exercise in the gym and causing your pain linked to that, and you more focus on how do I build up my muscle, the strength of the muscle. But I want to tell you, if you have a bad organs function, particularly when you want to build up your muscle strength, you feel the weakness, you feel pain, you feel tightness in the muscle for such long time, then you want to ask yourself this question: do I have bloating? Do my bowel motion loose or constipation? Do I have dry lips? Do I get heartburn? Do I get bloating? What else? Let me think about it. Muscle strength. Yeah. Do I get heartburn? We talk about, right? Or tightness in chest as well. Do I some certain food? Is there any certain food that make me sick? Or make me go to toilet or bloating? All those things. Now a lot of people talk about I'm allergic to gluten. Gluten make me bloating. Gluten make me go to toilet a lot, or dairy. So if anything related to food, you have all I just mentioned. If anything that you say yes, okay, that is a problem, and you're a sport person, and you want to build out your muscle, right? The strength muscle. If you have all the symptoms, conditions that I just mentioned, hey, you have a stomach and spleen problem, and you want your muscle strength to be better, or you want some pain to get better, you have to sort out the stomach and spleen function first. Otherwise, we'll always get relief, or you just take a painkiller to get relief and get your sweating down, but it'll always come back. Because the underlying issues is the stomach and spleen function. If it's always weak, then that will be a problem. For this patient's strategy is, yes, we do help with the knee pain, but at the same time, a more focus, more important is get the organs function, restore the organs function, because it's what we believe. Once your organs function restore, then we have different acupuncture. If I do the structural acupuncture, you see the result will be last longer. It will last longer, much longer, and you get better and better and better. Eventually, our aim is get you pain-free. All right. So this is our concept from Chinese medicine when we come to treat pain, and too many people focus on pain is just get relief, and our aim is get your function, the organs function, all better. Then your body will heal itself. All right. So this is the concept is very, very different with Western medicine or other therapies. Again, I want to show you some point for knee pain. Now we use distal point. In this case, knee is over here, right? So we can use here the opposite side. If knee pain is in here, we use the opposite side of elbow. If knee pain is in here, we use opposite side of elbow in here. All right. So I'm going to show you the elbow over here. So just go to this You probably can't see it properly, can you? Okay, here. So go here. If you go there, you'll find this tendon in here in the middle. You must bend your elbow first. Then what happened here is in the tendons on the thumb side and the little finger side, right? On the thumb side, you'll find tendinous spot. Okay, and when you find a tendon spot, it may be on here, it may be go down a bit or up a bit. So just go long to get the most sensitive one, or if they are all tender, just give it a rub, press it and massage it for about 30 seconds or a minute. Okay, then you go to the second one, which is the tendons on the little finger side. Again, go there or go up there, right? So any tendon spot, give it a rub. Okay, massage it for 30 seconds or 1 minute. The last point, you want to completely bend your elbow, and in the end of the crease, there's a crease in here. So in the end of the crease, and press it around here or up a bit, up a bit. Basically, it's all this part, right? All this part. If you can find any tendon spot, give it a rub. I reckon I suggest you get the most sensitive one and give it a rub first. Then in general, you should get instant relief on your knee. So your aim is to do it every day, once a day. Do it every day, once a day. Your aim is to remove the tension all in your elbow. Okay, this acupressure point, it will give you instant relief. You know, the minute you do it, you feel relief straight away. Okay, but if you're in Hamilton and Dunsdale and Auckland or Cambridge, we have clinic, we have our colleague in there, and the best thing is, hey, come in to make an appointment and come in and let us check that whether you have organs issue or not. But all this thing, it will treat you to get your knee more blood flow, but it may just symptom relief. You really want to get, like I said, whether there is any organs imbalance. Most of the time, you'll get more. If it's chronic, you get a organs imbalance before this pain start. Especially when you get pain, when you get relief, and then it keep coming back. It keep coming back. You know, you see over years and years, and you really want to restore your organs function, right? But what I just show you, all the acupressure points are very safe to use. Okay, are very, very safe to use. So go ahead and use it. Or if you worry about whether you get it to the right point or not, come to a clinic. We're welcome to show you face to face. You have 15 minutes pre-assessment. So this 15 minutes pre-assessment we'll give you for free, and we just ask you a few questions and take your pulse and see your tongue and see whether we can help you or not. If you would like our help, come in, call 078467956, 078467956 to book an appointment. So I hope the tips that I just give you, do it straight away if you have knee pain. And also, if you have family member or friends and they suffer from knee pain, just forward this email, share this video to them, tag them in to this video. Then, hey, you might just help your friends by just sharing my video. All right. So you stay awesome, and I'll see you tomorrow. See you. Bye bye.